I'd like to take a moment to provide a little bit of context around the 50 new cases that Maine CDC is reporting today. Of those cases, 18 of them are from York County, 7 are from Penobscot County, 10 from Cumberland, and 5 from Androscoggin County. York County in particular remains a focus and an area of concern for all of us at Maine CDC. Just in the past 2 days, there have been at least 29 confirmed cases of COVID-19 in York County alone. At least 16 of those cases have been associated with known outbreaks, and the other 13 at this time are thought to be related to community transmission. Now, of course, our investigation into those cases is ongoing, and we may later learn that they are in fact associated with an outbreak. But right now, at least 13 of those cases are from community transmission. As a reminder, that suggests that those individuals don't have any linkage to a known person with COVID-19 or with a known outbreak. That is strongly suggestive of strong, ongoing, sustained transmission of COVID-19 across York County. We've taken a closer look at the data in York County. And just in the past few days, the age range of those who have been affected by COVID-19 spans from a low point of people in their 20s all the way up to people in their 70s. So this uptick of cases of COVID-19 in York County is not a phenomenon that's limited to long-term care facilities or even limited to congregate care settings. Moreover, the positivity rate in York County is now 1.8% over the past 14 days. That is 3 times higher than the statewide positivity rate. In addition, the rate of new cases of COVID-19 in York County over the past 14 days is now 7.5 cases for every 10,000 people of new cases just in the past 14 days. 7.5. To put that number in perspective, the statewide average of new cases over the last 2 weeks is 2.75 for every 10,000 people. We've also taken a close look at the onset dates of illness for the recent cases we've had in York County. And what they tell us is that transmission is continuing and occurring with an increasing frequency in York County. When we look at when individuals are getting sick, they're not telling us that they were sick 3 or 4 weeks ago and just happened to have gotten tested. Instead, they're telling us that they first started getting sick 2 or 3 or 4 days ago, not 2 or 3 or 4 weeks ago. Right now across the state, about half of the outbreaks that Maine CDC is involved with are in York County. Across the entire state, about half of the outbreaks are centered in York County. And one of the things that we've learned over the last 6 months of working with outbreaks of COVID-19, no outbreak is an island. What this really, outbreaks are not isolated events. One outbreak can quickly lead to several more outbreaks, especially in a close geographic area. Moreover, the outbreaks of recent days and weeks in York County have affected numerous areas of community life, workplaces, universities, and churches. All of this means that there is now strong evidence that the virus is with us, and in certain parts of the state, like in York County, has resulted in sustained, widespread transmission. For that reason, York County in particular remains an area of high concern and high focus for all of us at Maine CDC right now. I'd like to take a moment to provide an update on some of the outbreaks that Maine CDC is working on. Speaking of outbreaks, well, let's start with an overview of the outbreaks that have emanated from the wedding in Millinocket that was almost 1 month ago now. Right now, there are 144 cases associated in some way, shape, or form with that August 7th wedding. 56 of those cases are wedding guests and their secondary or tertiary contacts. One of the cases is someone who is a secondary contact of a guest who also happens to be a staff member at Maple Crest. In addition to that individual at Maple Crest, there are 15 additional cases at that facility. 8 of them are among residents and 7 of them are among staff. When including that one individual from the wedding, that now results in a total of 16 cases at Maple Crest. In addition, there was one member of the York County Jail staff who attended the wedding in Millinocket. In addition to that one individual at the York County Jail, there are now 18 additional staff members who have tested positive, 46 inmates who have tested positive at the York County Jail, and 7 family members of staff who now have confirmed COVID-19 infections. All told, again, 144 cases of COVID-19, either directly or indirectly linked to the events of the Millinocket wedding on August 7th. Let's take a closer look at the York County Jail right now. As I mentioned a moment ago, there are now 72 total cases associated with the jail. 46 of them are among inmates. That's an increase of 8 new cases among inmates just in the past 24 hours. What's been concerning to Maine CDC is that these 8 new cases among inmates are in a different part of the jail, an area of the jail where there had not previously been cases. Also, there are, as I mentioned a moment ago, 19 total staff members associated with the jail and the county building. And again, 7 family members who are close contacts of staff who have now tested positive. One note, there have also been 10 family members that we identified yesterday as probable cases who have now tested negative. We continue to work with the York County Jail. Retesting is ongoing, and we anticipate receiving additional sets of laboratory samples up here at our lab in Augusta as the jail continues subsequent rounds of testing. As always, our concern level remains high for this as well as all outbreaks, and we continue to remain engaged with officials at the jail. Another outbreak in York County that we are tracking and working on very closely is that associated with the Sanford Calvary Baptist Church, where there are now 10 cases of COVID-19. That's an increase of 5 cases since yesterday. One note for everyone, the 5 new cases associated with the Calvary Baptist Church are not reflected in today's case count. They will, however, be reflected in tomorrow's case count. We've been in regular communication with the pastor of this church. In fact, just this morning, we sent a letter to the pastor recapping our public health recommendations and outlining our expectations of compliance around those recommendations. We've offered not just recommendations, but also assistance in obtaining things like face coverings and connecting parishioners and congregants, as well as others who may have been at the church, with our contact tracing program.